My name's Tev Aho. I'm a consultant urologist. So I chose to become a urologist because I did a urology rotation in my first ever year as a doctor, and my heart was really set on urology as a career option from that time onwards. So one of the things is that in urology we help people with a wide range of conditions, ranging from cancers, life-threatening cancers, to benign conditions that can cause major disruption to people's lives. And the thing I particularly like about urology is that we're able to cure most of these conditions rather than just helping people to cope with them. We can make a real difference to people's lives, and my patients often tell me that I've given them their lives back, which is an extremely touching and humbling thing to hear. I also like urology because I enjoy doing surgery, and it's a surgical specialty. And as a surgical specialty, urology is actually often at the cutting edge of technological advancements in surgery, which is a very exciting place to be. And I've been fortunate to have been at the forefront of the development of laser prostate surgery and laparoscopic or keyhole kidney surgery here in the UK over the past 20 years. And it's an amazing thing to be able to look back and see the benefits that these new technologies have brought to improving patients' lives. I really enjoy listening to people's stories and helping them to understand the cause of their symptoms, and then empowering them to make the best possible decision for themselves and for their own particular circumstance as to the best possible treatment plan. Tailoring treatment to each individual person's hopes and wishes and needs is a very satisfying thing. I think that gives me a lot of satisfaction. I also find it very satisfying in giving people the confidence to often take the plunge with their treatment that often they might have been putting off for some time, perhaps because they were a bit anxious or concerned about side effects or what the treatment might involve. So I find it very satisfying to sit down, listen to people's concerns, discuss things with them, various treatment options to help them to come up with a plan really that they have come up with largely, that they are very comfortable with. So patients who come to see me can expect to meet with a friendly, engaging person, somebody who has empathy, somebody who has a lot of experience in urology. I've been working as a urologist now for 20 years. I think I've seen many patients over the years, and I think I've gained a fairly good understanding of how various urological conditions can affect people's lives, and I've also developed an understanding of what tends to work best in terms of improving people's lives for them. There are generally two groups of people, I think, these days. There are some people who come in and they just really want to know what I would recommend as a professional in their circumstance. You know, they're perhaps not too worried about, they don't want to get too involved in the nitty-gritty of the finer details of choices of various treatment options. They just want to know what I think, given what they've told me, is best for them. And I'm very happy to let people know what I think is best if that's what they want. But also there are people who want to be as involved as they possibly can in understanding every single detail about their condition. And I have a lot of empathy for that sort of situation. That's the way I would be myself if I went to see a doctor. So I'm very happy to spend time listening to people, listening to what they may have heard elsewhere or seen in the media about their condition, and talking to them in as much detail as they want, so that they can feel as comfortable as possible in moving forward with their treatment.